space to exploring the interface human, animal, and the disease. So we will start first with the pre-test questionnaires, and then we will have the presentation from both experts from Lao Hun and Mai Hun. Then we will have the presentation from both representative of the student club from Lao Hun and Mai Hun. The next step, it will be the panel discussion, and then we will have the Q&A session as well. The last session will be the post-test, and finally, we will have the photography session to make our webinar be more memorable.
Wow, what an interesting journey. I can't wait to start right away. But before we dive in, I would like to remind few housekeeping notes to the audience. Please keep your microphone muted to refrain from disruptions during the session. Remember, this webinar is not just about passive listening. It's about active engagement, and you feel free to ask few questions, to share your thoughts, and also connect with the fellow attendees. Let's make the most out of this collective learning experience. To kickstart our webinar, I will pass our session to Lao Hun for the pre-test questionnaire.
Yes, please share the pre-test questionnaire. Yes, can everyone see the screen? And please scan the QR code and enter to the pre-test questionnaires. If there is anything or the technical terms, errors, please feel free to leave us in the chat box, so we will assist you accordingly. We have 5 minutes for this one. Can everyone access? If everyone can access to the questionnaire, please like thumb up or raise your hand or give me some heart, give me an arm some heart. Yes, thank you. I think we have to set the okay. It's fun for 2 more minutes. Yes, I finished. And can we see the screen of the respondents? Like how many of the respondents has okay, if everyone still cannot access to the questionnaire, we also have in the chat box for the link. Yeah, we really have 3 respondents. Now, Amy, can you share the screen for the respondents? Is it 6 now? Yeah, we will have 13 more minutes. Oh, not minutes, seconds. Yes, please, because we have like almost 100 participation today. So please, only 8. Okay, because we will deep dive to the many insightful topic today. So yeah, we can see after the post test too. Okay, I think it's 5 minutes already. We can go ahead. Yeah, thank you very much, ladies and gentlemen, who participate the P-test with us. And for the next session, it will be the expert presentation. So I will pass this to my own back to conduct the most about the session.
Thank you, Poi. Without further ado, let's continue our webinar by introducing our very first esteemed speaker from Laos. She is currently working at the Faculty of Veterinary from Champasak University. She is none other than Dr. Bempen Komungkun. Please give a warm virtual welcome as she shares her expertise with us. Doctor, please.
Good afternoon, everyone. I'm Bam Hen from Faculty of Agriculture and Forestry, Champasak University. Let me share the screen.
Good afternoon, everyone. My name is Putnapa Sangsanyarat. I'm from Faculty of Agriculture and Forestry. Today we are team. I would like to talk about the wildlife trade and trafficking zoonotic disease in Laos PDR. So the first, our topic was presentations of the first is wildlife trade and consumptions in Laos, especially the southern of Laos is Sekong and Salavan province. And then I would like to talk to the market survey and the species in different wildlife and the price of the wildlife meat. And the last one is zoonotic disease from wildlife to human. For wildlife trade consumptions in Laos PDR. Laos PDR is a landlocked country bordered by China, Myanmar, Thailand, Cambodia, and Vietnam. The country is part of the Indo-Burma biodiversity hotspot. And within Laos PDR, the central animate most forests have been identified as one of the global 200 endangered regions, making it a top priority for conservation efforts. According to the National Biodiversity Strategy and Action Plan for 2016 to 2025, between 100 and 200 species of the reptile and amphibians, 700 species of birds, 19 species of bats, 100 species of large mammals, and 500 species of fish have been described in Laos PDR. And as much 19% of the over 1,400 species are consumed by local people, within 15% in the total protein intake consisting of fish. For the wild trade, total of 800 animals were found for sale, half of assessment and reptile species and 38% of bird species found. Protected under categories under the wildlife and aquatics in Laos PDR trade network in certain area of the province basic. Understanding about consumption pattern across province appear to be sale in Salavan or other finding suggest frequent trade in Vietnam, draws trader and method. In the area closer to Vietnam border, such as Samui district in Salavan province, Galum district in Sekong at border to Attapeu province, we received 10 several accounts with Vietnamese trader. In one instance, we witnessed between hunter and a Vietnamese restaurant owner in who could potentially also be trader himself. A visit to small village also is only 40 households. And Ban Ungs in Galum district gave us about the opportunity opportunity people. They are there and to try to better understand the trade dynamic. Okay. The first of the wildlife market is the chance of the hunter will hunt in the forest and bring it into the wildlife market in our rural area. They are the most of wildlife because a lot of people like to eat wildlife. Okay. The wildlife trades around Taoy district, Salavan province. The first is the Lao hunter hunt in the forest, and then the first is Vietnam trader bring it to Vietnam trader. The second is Vietnam restaurant, and the third one is local market and the consumer. Observation at the border of especially for the Lao Vietnam border, it's easy to transport for a wildlife to Vietnam. So we saw a lot of Vietnam trader come to buy wildlife from Laos. Okay. For the total species of 800 individuals were found, and we were identify 69 species, 65 genera, 35 family, and 17 other at location. Half 50% of assessment is mammal species, 38 of species is the bird, and 50% assessments is reptile species found in the survey. Are classified under category 1 by the wildlife and aquatic law, meaning they are under the protection status, and hunting and trade of these prohibited. Okay. For the species in different IUCN categories, we saw that for critically is is reptile for 3, and for endangered for mammal is 2, and birds 1. Vulnerable is mammal 4, and threatened is mammal 1. For the lead concern, we saw that 19 report by WWH 2021. Okay, for the price of wildlife meat in Laos, that show in year 2021 for the pork price is only $2 per 1 kilo, but for the wildlife price is most expensive in the market. Show that in the small scale is small scale is 1.5 US dollar per individual, and for the small ground scale is 10 US dollar per 1 kilo, and for small Indian savage it's $7 per 1 kilo. Red snake is $5 per 1 kilo. For the female green purple is $15 per 1 kilo. That shows that the price of wildlife is more expensive than the price of pork. For the next step, bring it to Dr. Bampen.
Thank you, Munapa. And for the next topics, I would like to talk about the zoonotic disease. As we know, zoonosis is a disease that passes from animal to humans, and the zoonotic pathogen is maybe virus, bacteria, or parasites. And the significant way that the human infected the disease from animal, that's where the direct contact, food or water consumption, or via the environment. Sorry for inconvenience. Okay, in Laopedia, zoonotic disease from wildlife to infect to humans that are considered as a serious problem on public health. The important way of the infections of humans in Laopedia is a wildlife meat consumption. The example of the disease that outbreak or infects from the animals such as the Ebola or monkeypox, and the wildlife market is the significant area or site for the disease collections or disease place because the visitor will come to the markets and they will buy the wildlife and bring them to their household for cooking. And the small mammal is the important source of the pathogen. For the previous reports about the zoonotic disease were studied in the wildlife in Laopedia. They report about the zoonotic pathogen. They found so many species of virus, bacteria, parasites. For another previous reports about the zoonotic disease in Laopedia, they study in 6 provinces of Laopedia, 4 provinces in central parts and 2 provinces in southern parts of Laos. And they collect the sample from the wildlife markets, 11 markets. And the result of this study, they found the zoonotic pathogen, including Leptospira, Rickettsia, and Anaplasma.
โดยอาจารย์ขออนุญาตรออาจารย์ตอนนี้อาจารย์นั้นเหลือประมาณ5 นาทีเลยอาจารย์ We have 5 minutes.
Thank you. For the one example of the zoonotic disease that passed from animal to the humans is a monkeypox. As we know, monkeypox is a disease. The humans can infect by the physical contact with the infected animal, and the humans can infect from the human to human by the direct contact or contaminated material contact, such as coating or bedding. And the first case of monkeypox disease were reported in Laopedia in 2023. Therefore, the Ministry of Health they provide the accurate information about monkeypox transmissions, list of infection symptoms and prevention for Lao people. And also, Laos has been joined for the knowledge and understanding promotion for Lao people too. And the necessary things is for monkeypox prevention is a community communications for provide the information for Lao people. For the last slide, it's a challenge why zoonotic disease that pass from animal to humans in Laos is still occur. That's maybe because of in the rural area of Laopedia, people some people, they are the hunter. They go to forest and they hunt the animal. They bring them to sell at the market easily. So the disease can spread to the another place. And the second condition is the old days. A lot of people, they believe that eat wildlife meat can make them be healthy and strong. Because of that, we hope we can strengthen the understanding, the knowledge about the impact of zoonotic disease to allow people, and we aim to the reduce and prevention the disease in the future. Yeah, that's all of our presentations. Thank you very much for having us in this meeting.
Thank you, Dr. Brampton. I think it is very important for us to have this exchange of information in terms of zoonotic disease, in which it will also give us some insight on how zoonotic disease can be spread. So up next, we will have Dr. Nur Nabila binti Sarkawi. She is a veterinarian who will be representing Malaysia for today. She had completed her Bachelor of Doctor of Veterinary Medicine in UPM, and she had worked as a veterinarian in Wildlife Rescue Unit in KK. And currently, she serves as a veterinary officer in Sepilok Orangutan Rehabilitation Center, Sandakan, Sabah. With that, I would like to invite her to discuss on our topics today. Dr. Nur Nabila, please.
Thank you, Mr. Anis Ahmad. Can you hear me well?
Yes, doctor.
I'll share my presentation first. Can you see my screen?
Yes.
Okay, thank you very much. Thank you for the kind introduction. Hello, everyone. Good afternoon from Malaysia. I'm Nabila. I'm a veterinary officer from Sabah Wildlife Department, but I'm based at Sepilok Orangutan Rehabilitation Center. So today, I will talk more about the diseases side because I'm working more with diseases and treatment and stuff. But I would like to share with you cases I encountered so far related to zoonotic disease and how actually we manage it. But today, also my focus will be towards the orangutan. So bear with me if you had orangutan. And for those who like orangutan, I hope you will enjoy my presentation. Okay, as you can see from the picture, it tells you a lot about how we care about orangutan, holding hands with the orangutan, but with gloves, because we are really concerned of the transmission of zoonotic diseases here at our center.
Hello, doctor.
Yeah.
I'm sorry, can you readjust your slide? I think it's not clear.
It's not clear.
Yeah, some part of it is being covered.
Oh, okay. Wait, I think I need to change into PDF. Sorry for taking time. Share first. Is this view okay?
Yes, doctor. This is
Okay.
much better. Thank you.
I'll use this one. Okay. So actually, Sabah Wildlife Department is a government state agency, which I won't go through each of our function, but generally we are protecting the endangered flora and fauna by managing them in terms of preventing any illegal wildlife trade, doing wildlife conservation and rehabilitation, doing wildlife research, doing wildlife conventions, seminars, wildlife education and stuff. Basically, our function is to protect all this flora and fauna endangered in Sabah. Okay, so we know that zoonotic diseases are diseases that can be transmitted from animal to humans and vice versa. And more than half of the infectious disease are spread from animals, and most of it are from the wildlife, which act as a reservoir. And in how do all these infectious diseases emerge? By means of deforestation, land use change, antimicrobial resistance, illegal wildlife trade, climate change and stuff. And I don't know if you know this, but pangolin is the most trafficked mammals in the world. And pangolin actually carries a lot of viruses, human viruses that can be transmitted from animals to humans. I mean, zoonotic viruses. So my focus today, I won't talk a lot about how disease transmitted. Like I said just now, I would like to share cases that I've encountered, zoonotic disease cases. And I would like to introduce to you my workplace, Sepilok Orangutan Rehabilitation Center. Why I choose to introduce to you about Sepilok is that because Sepilok is a perfect example where one health scenario happens. We have orangutan, which is the animal. We also have ecotourism activity, which we have the people, the visitors coming in to visit the orangutan, and we have the forest. So for me, introducing to you guys about the scenario in Sepilok is a perfect One Health examples that actually is a real life cases. All along, we just read journals, we just read textbook, but I wanted you to know what happens at the field. So in Sepilok, we actually work towards 5 pillars, 5 main objective, which is the orangutan rehabilitation. Ecotourism, we receive tourists locally and internationally. We did a lot of wildlife rescue, translocation. We also give public education awareness and assist in any research and training like master project, PhD project. Some fact I would like to share with you about orangutan. Orangutan has a lot of things similar or in common with us. They have 96.4% DNA similar to us. Their gestation period of around 8.5 months, also similar to us, which is 9 months plus. The female orangutan menstrual cycle is around 29 to 32 days, with the menstruation lasts for about 3 to 4 days, also similar to us. And orangutan, like humans, have 2 sets of teeth, 20 deciduous and 32 permanent. So I can say that orangutan is actually our cousin. We have a lot of things in common in terms of anatomy, biology, physiology, and it makes sense that we also shared the same disease with them. I'll show you some examples later. This is my oldest orangutan in Sepilok, tiger, but he's an orangutan, not the tiger. Okay, so there's an article proving that COVID-19 and also other diseases of human origin can be transmitted to orangutan and vice versa. So the diseases that they mention on the articles are such: hepatnaviridae, of virus origin; of bacteria origin, we have melioidosis, tuberculosis; parasite, we have malaria, strongyloides, and amoeba. And all these can be transmitted directly or indirectly, and also through animal vectors such as mosquito. It proves that we share same disease with orangutan. Okay, let me introduce to you the first case that I encountered during the early days of my working life. This is my first postmortem case. I have an orangutan with symptoms or clinical signs of inappetence, intermittent diarrhea, and also inactive. So the orangutan is not responding to any of treatments such as like common antibiotics and stuff, not responding to any medication that I gave. The orangutan keep on deteriorating for about 2 weeks. The orangutan died. Sadly, unfortunately, the orangutan died. And I did postmortem, and it reveals this kind of lesion. For me, doing postmortem, if you see some lesion, for me it's very beautiful. Okay, so we found multifocal, we call this multifocal granulomatous lesion, which is very typical of tuberculosis and melioidosis. We were quite surprised because the animal doesn't show like typical symptoms like coughing. No, the animal just showed clinical signs of inappetence, inactive, just like that. So when we sent samples for bacterial culture, it was positive for melioidosis. Luckily, we were full PPE at that time doing the postmortem, and no humans succumbed to the disease after the postmortem. So it's a very beautiful lesion, as you can see. My first postmortem and my first encounter, the first time I encounter zoonotic disease in animals. I never learned this in textbook, and it happens in real life. Okay. Next case I want to share is hepatitis B. Yes, orangutan can get hepatitis B, not just human. We screen our orangutan every year, and for newly rescued orangutan, we also do all those kind of screening like malaria, tuberculosis, hepatitis, melioidosis. And it appears our healthy orangutans, from serology screening, they are hepatitis positive. There's no symptoms, no clinical signs. So the orangutan was immediately quarantined because we are afraid that it will infect the other orangutans and also the staff. So we quarantine them and we handle them by using full PPE. Thankfully, we have EcoHealth Alliance at that time who is willing to further analyze the hepatitis infected the orangutan, and they proceed with PCR analysis. And it was found out that the hepatitis that the orangutan get was of orangutan strain, not human strain. It is of orangutan hepatitis B, which is endemic to wild orangutan. So they might be just the carrier. They are not infected by it, but they have the virus. They are the carrier. So following the analysis, PCR analysis, we still quarantine orangutan, monitor the symptoms, and annually screening, do annual screening on them. And all the orangutans now is negative for this hepatitis, and they are released. So this is another case of zoonotic diseases, but when we further analyze it, it is not a zoonotic concern. Okay, the third, I think the last case to share with you guys is Balantidium coli and strongyloides. The symptom is diarrhea. Orangutans have diarrhea, and when we did fecal smear, they come out with strongyloides and positive B. coli. So how it can infect human by fecal oral transmission? When people are not practicing good hygiene, they can easily get this parasite and protozoa as well. So by practicing good hygiene, especially the staff, is very crucial so that they won't succumb to these diseases that which the orangutan carries. We have cases of volunteers coming in, they are not washing their hands properly after handling orangutans with diarrhea. The next day they succumb to diarrhea. So it's very important to practice good hygiene. Okay, so that was some of the cases, zoonotic cases that I've encountered with orangutan. So how we actually manage it to prevent the spread of disease among the staff, other animals, and also the public that visited us, by approaching through these four components: the staff, wildlife, the premise of center, and also the public. First, for the staff, if there is any like sampling procedure, post-mortem, they are required to wear full PPE. When I say full PPE, they must wear Tyvek, goggle, mask, face mask, which is N95 or 100, and also glove. These are very important to prevent them from spreading the disease and prevent them from getting the disease. The first picture, which is the sampling procedure, is during COVID times. We want to screen all of our orangutans with COVID-19. Fortunately, luckily, we don't have any positive cases among the orangutans, because why we want to screen them is because one of the staff get COVID. We just want to make sure that all of our orangutans doesn't get COVID. So this time, during the COVID times, it is very worrying, because once orangutan get COVID, we are afraid that they will succumb to death, which will cause another factor of extinction. Okay, the second picture, post-mortem, we did a lot of post-mortem of animals, and we don't know what kind of germs, what kind of agent, what kind of pathogen that animal bring, what kind of pathogen that animal has. So it's very important to wear full PPE as well. Okay. For elephant, just for information, they also get tuberculosis. So it's very important to wear all this PPE. Okay. In other cases, we have cases of animal handover. Other than orangutan, elephant, we also get rescued injured pangolins. So during animal handover, we practice wearing PPE as well, wear N95 mask, glove, and wear gumboots. Okay. So another thing is, wildlife rescue. Like in this picture, we did orangutan rescue. This was this was during COVID times. The orangutan was very sick. So yeah, we wear full PPE as well, although it's very hot. It was very hot and sunny. We have to wear them for safety. And also during routine work, every day we have to wear glove, mask, and boots to work to prevent all this disease transmission. And the staff also compulsory to do medical screening, such as full health screening, tuberculosis, melioidosis screening, malaria, and also hepatitis. All the staff have to be healthy, fit, and negative for all of these infectious disease. And if they are negative, then only they can work with animals. But if one of it positive, like they have tuberculosis or malaria or hepatitis, they cannot touch animals. They can only work with other humans, not animals. Okay. In terms of wildlife, how we control and prevent the spread of disease by doing medical screening, same as the staff. We do for our captive animals, we do yearly screening of full general health screening, tuberculosis, melioidosis, malaria, and hepatitis. We have ward, especially for isolation cases, which is for those orangutan that are sick. We isolate them immediately to prevent outbreak of disease. And for newly arrived animals, we place them in quarantine before mixing with other animals. They will undergo quarantine for 3 months, okay? And for any sick animals, we did a prompt treatment to make sure that the disease is not spreading.
Hello, doctor.
Yes?
There is 5 minutes left for your presentation.
Okay, I'll talk faster. So for the premise and public that are visiting our center, we have food bath before they entering our premises. Every visitors is compulsory to wear hand sanitizer that were provided. And public are not allowed to enter clinic area. Only staff and those that have full medical screening can enter clinic area for only work purpose, like research purpose or for research purpose and for like treating purpose. And we have developed SOP and guideline in place. And lastly, we always educate them about the importance of like, you have to be further away from the orangutan. Do not come close to the orangutan, monkeys, or any other animals that you encountered throughout the boardwalk or throughout the forest. So yeah, we have visitors guideline. They cannot feed the animals. They are highly recommended to wear face masks. They must wear hand sanitizers, and they have to keep 2-meter distance with orangutan or any other animals. Okay. So I wanted to promote to you guys that what you can do as a public, as a student, as an individual to protect our wildlife in Sabah by reducing the usage of wildlife, reject from buying illegal wildlife. We think before you want to keep wildlife as a pet, report if you found or if you heard or if you read any illegal wildlife activities, and remind yourself that you and people around you can make changes. Okay, so thank you very much. I hope you enjoy my presentation, and yeah, thank you.
All right, thank you, Dr. Nurunabila. What a shocking fact is especially that orangutan can contract the same diseases same as humans, such as hepatitis B and melioidosis. And I believe that most of us here today did not aware that the similarity between human and orangutan. So I guess there has to be a reason why they are called as orang. All right. For our next session, I would like to invite La Oh Hoon to introduce the student representative from La Oh Hoon for the introductory session. La Oh Hoon, please.
Yes, thank you, Ahmad. Ladies and gentlemen, allow me to invite Ms. Pontida Intawong, the Vice President of Lahun Student Club, and together with Mr. Paitun Bunyawong, the Lahun Student Club Secretary from the University of Health Science. And now may I pass the floor to you, Pontida and Paitun, please.
Hello everyone. Can you guys see my presentation right now?
Yes.
สบายดี
Good afternoon, everyone. My name is Pontida Intawong.
And I am Paithum Yamon.
We are from University of Health Science in Laos, and today we are responsible for presentation in our club. The Lao Student Club was established in August 2022 at the University of Health Science and One Health in Lao, that means สุขภาพหนึ่งเดียว with collaborate between human health, animal health, environment for create good health for overall part as human, animal, and environmental. And in the club was created to enable students in health university to collaborate and express and participate in exchanging information with experience seeking disease in many groups. And we are start from narrow circle of academic year, and in the future we hope to join to other university both in Laos and abroad. Next is objective we have. One is significant for youth at the University of Health Science. Two is youth empowerment and skill development, creating future leader, and two is sustainably balance the health of people in Laos. And our mission, we including leadership, teamwork, communication part, and soft skill. And then we're gonna talk about Lao Student Club structure. We have president, vice president, secretary, and we have 9 teams in the club, including information, IT, organized, activity, photographer, graphic design, content creator, coordinator, and accounting that work together in our club. And we have 4 alumni, Dr. มีสัญญาสุนทร Dr. พุทธสอนพันธวงศ์ Dr. บัวใสสัญญาจิต and Dr. Bobby บุญญหัก founder of Lao Student Club.
And this actually is our first workshop since our organization has been established. Actually, it's last year, and it was the amazing workshop that including a lot of students from the University of Health Science that joining us around 40 students. And in that workshop, we also have the presentation of the student that joined that based on the topic One Health, such as the malaria, COVID-19, and vice versa. And also we also have the game and the singing and for the lab of the student, and also the prizes for the winner in that day that joined us. And it is our previous workshop that's based on zoonotic disease. And we also have the special guest from Thailand, the professor and teacher that joining us by online platform. And it is our volunteer that integrated by the National University of Laos and the University of Health Science, around 70 people that went to the community and collecting data, focusing on the One Health topic, actually about environmental and the food safety to help the Lao Hun. And this is our promoting and advocating and in the platform, such as the award, orientation, or the meeting, or the new workshop, and the many more of the Lao Hun workshop. And this is one of the remarkable training that we was trained by from Thai. She actually provided. She flew from Thailand and her assistant to teaching us about the branding and marketing, how to make the better promoting on the online platform, and the IT, how to the organization. And this is our previous interview to looking for the new membership in our part of the Lao Hun Student Club in the University of Health Science. And overall, we got about 11 people that become our part of the Lao Hun Student Club. And they are amazing. And this is what we got from since we joined the Lao Hun Student Club. Actually, it's leadership, communication, management, and teamwork and critical.
And for challenges in this year, we don't have space or room for our team, and through this technical problem like skill or knowledge, sometimes we cannot approve by myself, and we need teacher or professor to help guide in this more accessible to student budget constraint and collaborate with other organization and partners. And for future plan, we have community engagement activity, setting up a booth to spread the word about Lao Hun open house event and camping. And for online section, we have post thesis on Facebook. Here can you follow us. Please go in and please like and share on Facebook Lao Hun Student Club. And at this point, the presentation is over. Thank you everyone for listening.
Okay, thank you, Pontida and Paitun, for your wonderful presentation. And now I will pass to Ahmad for the Mahun representative of the Student Club to show their introductory presentation. Yes, please, Ahmad.
Thank you, Pai. For the next session, I would like to invite Ms. Nur Rodiatul Rashida. She is currently the president of One Health Student Club from University Malaysia Sabah, UMS, and currently undergoing her training in becoming a medical doctor. So, ladies and gentlemen, let us invite Ms. Rodiatul to take over the floor. Ms. Rodiatul, please.
Okay, thank you, MCs. So, Assalamualaikum and very good afternoon, everyone. I am Nurudit Rashida binti Rafai, the current president of One Health Student Club from University Malaysia Sabah for the session of 2023 and 2024. Okay, so next is so OHSC UMS was established in May 2023 under Faculty of Medicine and Health Sciences, supervised by Mai Ohun and also Si Ohun. So our vision and mission is as stated here, which is to empower the future health leaders towards advancing the holistic well-being of humans, animals, and also environment. Okay, so I would first and foremost, I would like to take this chance to thank our faculty for allowing us to establish this club and then giving me the chance to meet all of these great and talented individuals. Just like George Paula Lehman once said, the greatest asset of a company is its people. Okay, so even though our club was just established, we were able to accomplish and conduct a lot of activities and for the past session, and this is not possible without the help of each and every team members. So just like Steve Jobs once said, great things in business are never done by one people. They are done by a team of people. So our success of conducting these events are also due to the contribution of our partners and collaborators. So I want to give my special thanks to our partners, including Mai Ohun, Si Ohun, UPM, UKM, and then National STEM Association, Malaysian Society of Toxicology, SP Setia, Pusat Permata Pintar Negara, Youth Science, and also Kementerian Sains, Teknologi, dan Inovasi Sabah. So without further ado, let me share you our activities in a video montage. But let me represent my screen. Okay, so sorry for taking a little bit of time, but I would just want to share that we are thrilled to announce that OHSC UMS has officially released our second newsletter. So for the second newsletter, it comprises of messages from our dean, advisors, and also previous and current president. And we also followed by our conducted activities, future activities, and also introducing the new committee. So if you are interested, you can scan the QR link here and also click on the link which will be sent in the chat box. So this is the contents of the newsletter. And then these are our future activities which we will further do. So please stay tuned. And then, okay, thank you. That's all from me.
All right, thank you, Miss Rodiotu. That is a very interesting montage and also presentation from both La Ohun and also my Ohun. Before we move on, I believe we still have another video to be shown. Isn't it, Boy?
Yes, like is the video from the Lao Hun Student Cup also. So please share our video so we can see like how wonderful of both student cup they do the work into our communities. Yes, it's not a full screen. Yes, beautiful. I think the voice is not working. Maybe you can adjust accordingly. Yes, it's working now. Okay. Thank you for your both of the exciting videos, and it's really fantastic of the work, like really good work, guys. And to move on to the informative session, I will be the one who lead the panel discussion today. And before we start the panel discussion, may I ask if all of our speakers is ready? Yeah, please give us like heart, mini heart, or anything. Thumbs up or raise hand. Thank you, Dr. Nabila. Thank you. Okay, if we are ready, shall we go to the panel discussion accordingly now? Okay, let's start round one, the first round. And this question will pass to Dr. Nabila, my own speakers. It is Dr. Nabila, right? My own speakers. Yes, okay. The question is, how do human activities such as urbanization and deforestation affect the spread of disease among wildlife population? Yes, please.
Thank you for the questions. I'm not an expert when talking about zoonotic diseases, actually. No, yeah. This is my opinion. For me, when there is urbanization, it forces people to move into a particular dense area, particular city, particular area, which making it very concentrated, highly populated, and when there is disease occurrence, it'll be a large disease outbreak. And urbanization also force deforestation and land conversion activity to happen. So this combination of these two will actually increase human contact to pathogens with forest pathogens among the population that is lacking of previous exposure. And there is also an occurrence of pathogen adaptation. So I think this is how urbanization, deforestation, and land conversion contributing towards zoonotic disease outbreak or transmission. Yeah.
Okay, thank you, Dr. Nabila, for your insightful questions. And I believe that, okay, sorry. I believe that your question will be really, really crucial for everyone to get like more knowledge in this related to this topic. And next, we will pass to Lahun speaker. Ajahn Bampeng, are you ready? Ajahn Bampeng. Ajahn Watana. Yes. The question is, what are some successful examples in Laos for the One Health approach that being implemented to address wildlife disease and their impact on human and animal health? Yes, please.
Thank you for the good question. That's some successful of One Health approach being implemented to address wildlife disease and their impacts of on human and animal health. Example in Lahun and promote for the bypass of Lahun and another social to the people and the older people or another people to know about the dangers of the zoonotic disease and about the to there to do no need to eat most of wildlife because of the most of wildlife, the most of our people think that wildlife is when they eat, they will have the good, healthy, something like that. So that can show that about the improve there's knowledge to the kids to eat them. And for the university, that's also our university. We are the part of veterinary. We teach our students about that's dangerous of the for when we eating wildlife, and our students when they come back to home or they can tell the family, the villager or something like that to know about this. So can they decrease the number of population of Lao to eat wildlife and decrease the zoonotic disease also? Thank you.
Okay, thank you very much, Ajahn Watana. Yes, may I pass to the next step because our time is quite constrained. So the next will be my own student, and we will come back to our speaker again in Lao too. And this is the question for my own guest speaker for the student club. Are you ready? The question is, how can the student clubs do to help us link, no, not link, but to get to get the better understanding and also reduce the risk to the public health?
Okay, thank you, MC, for the question. So to answer this question, so One Health Student Club, what can we do like as a student club to improve the further understanding of public is by doing more activities, targeting a certain population or community. And for example, One Health Student Club has successfully done our first event after we were established is treasure hunt event. So for this event, we targeted secondary school students, and then we will give talks, and then regarding the zoonotic disease, all the signs or the complications, and then we will do activities which is treasure hunt themed, to monitor if the students really understand on how to know that the presentation of this disease. So after that, directly the students will gain more knowledge about the zoonotic disease, and indirectly they will further explain to others about what they understood about the zoonotic disease itself. So indirectly, the targeted population can raise awareness and also the knowledge about this zoonotic disease. So for me, all student clubs can do is by doing and conducting more activities towards raising awareness and knowledge to the public regarding the concept of One Health. Okay, thank you.
Wow, that's a nice word. Thank you. And yeah, not to pass the time, here is we'll come to the question for Longhorn student. Yes, get ready. What are the roles of the student club, like to raise the awareness of the One Health in public, and the transmission of zoonotic disease toward the wildlife? Yes, please, Titipon or Selena.
Okay, thank you, Miss Caroline. Can you hear my voice clearly?
Yes, very clear, Telly.
Good afternoon, ladies and gentlemen again. Actually, our project, our objective is to increase and expand Langhun members in Lao, educate and advocate about One Health, and side-by-side activities about One Health. So we spread One Health information to community to realize and aware about the transmission of zoonotic disease towards wildlife as well. On other hand, we enhance medical students in every faculty to can be one of the healthcare professionals who provide right information to community. For example, Langhun student field trip on site that we do 3 years with open opportunity for students at Network University in Laos to discuss and share problem and new way to solving in problem, including survey resource in community with find the best way to solve that problem together. And also, I am a member who running the project about the process plastic vigilante who raise aware and enhance the use about the environmental health, and we have running and reduce the plastic waste. Also, it's maybe it related to how to solve this problem and about the zoonotic disease in the community. Right. Thank you.
Thank you, Telly. Thank you, Titipon, for like this is an insightful and meaningful action, like in terms of our student club due to our societies. And let's go to the second round of us. It will be circle again to Dr. Nabila. And the question is, how effective can it be for the individuals who contribute to wildlife conservation to reduce the risk of the disease transmission? Yes, please, I will pass the floor to Dr. Nabila.
Thank you. How effective? For me, as long as the individuals contribute positively, yes, it will be very much helpful and effective. Like, I give you example, like little things matter lah. Such as you help us to repost facts about wildlife on social media or speak on behalf of the wildlife conservation on social media. Directly you spread awareness to your family and friends about detrimental effects of illegal wildlife trading. You ask them to reduce wildlife consumption. These all little things can make big changes in any way. Like what I've said in my presentation just now, practice the 5R: report, reduce, what else? Rethink. I forgot the other two. But practice the 5R, and you can effectively and positively contribute to wildlife conservation and directly help in reducing the risk of disease transmission. Yep.
Thank you, Dr. Nabila. Yes, I do agree. Like the family standard of people in the community can be the voice to, or if at least more, can make the big wave to our change in the community. So yes, thank you very much. And next, I will pass to Lahun speaker, Ajahn Bampen or Ajahn Watana. The question is, what are some emerging infectious diseases that professionals are currently monitoring, and how do they pose the list to both human and animal health? Yes, please. Yes, Ajahn Bampen. I think you unmute.
Sorry, I forgot to turn
Yeah,
on
it's
the.
okay.
For the current emerging infectious disease in Laos for now, I think is a monkeypox disease. Yes. We are have monitoring about the visitor from other country, because monkeypox disease is a import disease. So we have to space the more clear understanding and knowledge to the Lao people about the impact of the disease to the human health, and how to prevent it, and how to infect it. Yes, thank you.
Yes, thank you, Ajahn Bampen. Yes, the monkeypox is quite the disease that are hard to handle, but we as our doctors and the professional, they are the crucial opponents to combat with this disease, and I hope they will find a solution in the future. Yes, the next one is we will pass to Mayahun, student club representative. And the question is, can you provide the example of the successful collaboration between the Mayahun Student Club in terms of the combating the wildlife disease? Yes, please.
Okay, thank you for the question. So to answer this, we actually, after establishing this club, I think we focus more on zoonotic disease just more now, but we can implement this idea of wildlife disease in the near future for our future activities. But one thing for sure that I can say a success collaboration is today's webinar, because both my Ahun and also Lao Ahun collaborate together to raise more awareness, and then even me myself, I got new in knowledge and also awareness now regarding this wildlife disease. So thank you.
Thank you. That's an excellent answer. Yes, thank you very much because our collaboration is the significant step of our OHUNs, and it will be the next step to like achieve our bright future. Yeah, together with our Southeast Asia, One Health Network. Yeah, okay. The next question we pass to Lao Hun. What are some of the key challenges that Lao Hun Student Hub have found, like in the journey to raise the awareness in public, in terms of One Health? And there is any way that we can solve this challenge or any solution? Yes, please.
Good afternoon, everyone. I'm from Laos. I'm a member of Lao Student Club. And sorry for a technical problem that I can't turn on my webcam. And I would like to ask everyone this, is my voice clear?
Yes.
Okay, I would like to start with the challenge. The first one, I would like to say the limited resource. Student clubs often operate on limited budget and may struggle to manage funding for activities such as the workshop, seminar, or outreach event. The second one is sustainability. Maintaining long-term engagement and momentum can be difficult, especially as club leadership change with graduating member and new student join. The next one is engagement and outreach. Reaching and engaging diverse audience, including students, faculty, policymakers, and the general public, may require innovative outreach strategy and effective communication technique. And the last one is the competition of attention. Student club may face competition from other campus organizations and activity for student time and attention, making it challenging to stand out and attract participants. And I would like to continue with the various strategy that the challenge can be solved. The first one is the seeking funding. Student club can explore opportunities for funding through grants, sponsorship, crowdfunding, or partnership with local organizations or businesses interested in supporting One Health initiative. The second one is the building partnership, collaborating with other student clubs like today, academic department, research center, and community organization can leverage resource, expertise, and network to advance shared goals. The third one is the developing leadership and succession plan. Establishing clear leadership structure, mentorship program, and succession plans can ensure the continuity and sustainability for club activity over time. And that's all for my question. Answer, yes. Thank you.
Wow, thank you, Woon Pasong. It's quite a clear plan, and you can address the gap and the challenge that we can share by doing Laos. And may I lead you through the third round, and will be the last round of us. And there will be only 2 questions for our 2 speakers from Lao Hun and Mai Hun. And let's be passed to the next question. I think this question is quite interesting, in my opinion. Yes, Dr. Nabila, how do the socioeconomic factors influence the spreading of the disease in the wildlife population? And how do we address these factors to our interventions? Please.
Thank you. In terms of socio-economic, I give you an example. For low-income population, low-income community, it can lead to housing instability, poor nutrition, living in polluted and noisy areas. All of this, which can increase the risk of disease transmission. Other than that, in low-income communities or population, they always opt for bushmeat because it's much more cheaper and it's free. So when they opt for bushmeat, this can also increase the risk of zoonosis. So how can we address this is by us coming to them, approaching them, approaching this population by giving them education, like what the speaker from Laos had said just now, giving them health education. Because for me, I always believe in the power of education awareness. It gives a huge impact to people, to a community, to a population. So other than that, by giving awareness, we also can help them improving their life quality by improving their quality of life in environment. Help them in any way that we can, volunteer, like do activities, volunteer, like help this community. This, I believe, will in turn reduce the risk of disease infection. Yeah, as simple as that.
Well, thank you, Dr. Nabila. That's wonderful. And then we will pass to Lahun speaker as we like our time is still like coming in to an end. อาจารย์บำเพ็ญ or อาจารย์วัฒนะ like can the technology advancements such as the remote sensing or the data analysis like can help us to predict or manage the disease outbreak in the wildlife population? Yes, please. อาจารย์วัฒนะ I think you are mute.
For this occasion, I think it's the big data analysis is more requirement for our country because of right now, our country not just about the data of wildlife on any zone from the north to the south of Laos. And then it's about the artificial intelligence and machine learning. And also remote sensoring and state imager is required also. And the last one is the molecular technology. Is if we have this technology, it will be better in the future. Thank you.
Thank you, อาจารย์วัฒนะ And then that is all for our panel discussion. I am really amazed and of the outcome of our discussion today, and I believe that this session can give us like at least must have information to our participation today. Then to make our session more interactive, I would like to pass to Maya Home. Please bring us to the Q&A session as I saw the many questions in the chat box. Yes, please, Ahmad.
Yes, boy. Yeah, we do have some questions here, but we will try to make it simple because we are a little bit out of time. Thank you to those who had given the question. I would like to read a question from Kamisai. He or she asked about how can the growing issue of wildlife meat consumption in Laos can be addressed by the altering the societal beliefs and raising awareness about the consumption of wildlife. So I believe this question may be from Lao.
Yes, I think it's not the question that's focused on speaker or the student, right? So like anyone from student or like the guest speaker are welcome to answer this question. Okay.
Okay. Okay. I need to talk about the consumption of wildlife meat in Laos. There's right now is the most required, not also in Laos. Also they export from another country, especially Vietnam, something like that. For the price is the wildlife is more expensive, but they also need more it. But they don't know about the dangers of this wildlife meat. For this on this occasion, I think there's for on consumption of wildlife meat in Laos, not only from Laos, it's also only from another border country. So we should promote about the zoonotic, a lot of zoonotic disease from wildlife. Make them to have more or knowledge on this in the future. Thank you.
All right. Thank you for the amazing answer. I hope it answers the audience. And we still have one more question. This is from Nur Saiba. I hope I pronounced this right. If Sabah specifically have Orangutan Wildlife Center in Sandakan, she wonders if there is any kind of wildlife center in Laos. So perhaps the students or maybe Dr. Nabila, if you are aware of any wildlife center other than here in Sabah.
Okay. For about the wildlife center in Laos right now, we not yet have the wildlife center. Something like we have only the conservation forest. In our country, they have many conservation forests, but not yet have wildlife center. In the future, we hope to have wildlife center also because on the conservation area of our country, is the big forest and the big conservation. Anyone cannot come to hunt in this on this conservation. Thank you.
All right, thank you, Dr. Bampin. So, due to time constraint, I will have to limit the question and answer session for today. But no worries, for any other questions or any other doubts, you guys can always email us. You can email for OHSC, My Ohun, or also La Ohun, and we will redirect this question to the speakers. All right. So I hope that all the audience can gain something from the question and answer session, and you guys may email us the questions. And also,
Hi. Hello, could I just say something regarding the last question about the wildlife centers, if that's okay? The
okay, sure.
conservation centers. Yeah, so there are 3 conservation centers in Laos, one more towards elephants, one that is directed more towards bear, which is Free the Bears, and then there is the Lao Conservation Trust for Wildlife. So we do rescue and rehab of all species, and we run active and passive disease surveillance programs. So I just wanted to mention that it does exist. There's not many, but there are a few that are working on this.
All right, thank you, Melody. That is a very important input from you. Thank you for sharing it with us. So, in conclusion, there are wildlife center in Laos, and I believe in the future we will have more in both countries. So, thank you also to the panels for answering the question from the participants, and I hope we can gain benefit in many ways. La Ahun, may we proceed to the last session of this evening?
Yes, thank you. Thank you, Melody, for asking us for more information. And I believe that the Center for Elephant is mostly located in the north part of our countries. So thank you for that. Is the new information too. And next, shall we go to the protest questionnaires? Please let me share the screen and also the link for the first test questionnaire too. I'm not sure if we would like to share like the results for all participants in the screen or not, but please feel free to share if you would like.
Yes.
Hello, Melody. Do you have any additional comments? Because I saw you raise your hand. Please, if you have any additional to add. Okay, I hope we all see the screen for the protest. Please feel free to scan the QR and please answer our protest and what is we would like to know if how effective and how can the webinar contribute to give the knowledge and also the insightfully for our respondents, both students and all participants from Mai Hun and also Lao Hun. Please answer the protest for us. So in terms for us to make a better webinar collaboration in the futures. May I know how many respondents? Dr. Me. Then we still have 2 more minutes for that. And then we can go to the photography session. It's 19 now. Boy. It's 19 now. Wow, that's nice. Yeah, but we have 91, so it's a sweep one. So please answer our hostess. Please kindly respond to that. And yes, yeah, we can get all we can do that after that also after the webinar. Please feel free to do that also. It's 28 now. Yes, nice. Okay, Ahmad, I think we can go ahead. And thank you for your participating in the protest questionnaire. You can continue to answer the protest after the webinar ends. And yes, Ahmad.
Yes,
Yes.
all of the audience are still welcome to answer the post test. I believe we have gained a lot by engaging in this today's webinar, and which I would say very eye-opening. And I hate to break it for you guys, but unfortunately, we have arrived at the end of our webinar today. But before we bid farewell, let's reflect on some of the key insights that we have gained today.
Yes, it's been incredible day today that filled with the insight and valuable discussion, right, Ahmad? And one
Yes.
thing that stood out to me was like the panel discussion that, yeah, we can exchange our knowledge and also the blackout of the work in the wildlife section that we share from both Mahun and Lahun, so we can learn with each other and get to know more the situation and also the case like in both country and that have the different geographical. So yeah, this is really fantastic. Yeah.
Yeah.
How
Yeah.
about you?
I would like to add just a little points to it. I feel like it's really a meaningful session with the speakers earlier today from both Laos and also Malaysia. They did talk about the things that we are not aware of, we do not hear of every day, which are the zoonotic disease in orangutan, and also how a societal belief plays a major role in terms of spreading the zoonotic disease by wildlife consumption. So I hope in the future we will have more awareness on these two topics, and I think that's all from me.
Yes, I couldn't agree more. And now we arrive at the end of our webinar, guys. And to make our webinar like have more meaningful moments, please may I request you to open your cameras and give us the brightest smile of yours and let me capture the picture and memorize this wonderful moment that we contribute together as our collaboration. Yes, please.
Yes, all the students, the audiences, professor, lecturers,
Yes.
please open up your cameras and smile to the camera.
Okay. I still saw some that they still turn off. And could you please? Yeah. Okay, I'm not sure, like, will I change the wheel first? Okay. Well, we have a lot. So we will have like full screen to contain like 100 participants now. And there's still some that didn't open the cameras. Please feel free to do that. Or if you are not comfortable to open the camera, it's okay. I will capture your name. This would be good. Okay. 1, 2, 3, please smiles. Captures. Yes, the nice one, Ahmad. The please mini heart. Give us a mini heart. Mini
Yeah.
heart. Okay, mini heart. Okay, let me capture for the next another's. Okay. 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 Can I have one more for the last shot? Okay. 1, 2, 3. Okay, nice. Thank you, guys.
All right, thank you. As we draw to a close, I want to express my gratitude to each and every one of you. Thank you, Dr. Bampen and her colleague. Thank you, Dr. Nabila. Thank you to my Ohun, Law Ohun, C Ohun, all the audiences, lecturers, students. Thank you so much for your attendance and active participations. Let's carry the momentum from this virtual webinar forward as we continue to explore and innovate in the realm of our topic today, which is wildlife warriors, exploring the interface of humans, animals, and disease. Until next time, stay curious and keep the conversation going.
Thank
Bye-bye.
you. Bye-bye.